Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Dr. Ateet Patel, board-certified interventional and structural cardiologist and Chief of Cardiology at Vitruvian Healthcare System. Dr. Patel attended medical school at the Emory University School of Medicine in Atlanta and completed his residency training in internal medicine at the University of California, San Francisco. He then earned his MBA at Northwestern University-Kellogg School of Management in Evanston, Illinois. Dr. Patel also completed fellowships in cardiology at the Northwestern University Feinberg School of Medicine in Chicago. Then he further trained in structural and interventional cardiology at the Emory University School of Medicine in Atlanta. And Dr. Patel, thank you for coming on our show.
I'm glad to be here.
So today we're going to talk about the cardiovascular healthcare provider and patient relationship and how that has evolved with modern medicine. And Dr. Patel, how would you define a strong patient-provider relationship?
Well, it's multifaceted. It first begins with trust and open communication. We want patients to feel comfortable sharing their stories and asking questions. Continuity is very important and matters. We want patients to be able to see the same cardiologist and the same team through their hospitalization and into the outpatient setting. We also engage in something that we officially call shared decision-making, which is a variation on how healthcare was delivered many years ago, where now we present patients with options, involve the patients and their families in choosing what is particularly right for them.
Well, that's really cool. Has modern medicine really affected the patient-provider relationship?
It has in a lot of ways. We obviously have more diagnostic capabilities, including imaging, remote monitoring, and lots more data to inform our decisions. And technology has now pervaded that patient-provider relationship, and if used appropriately and used well, can add value to patient encounters, but needs to be done so in a careful and thoughtful way to not override the patient-physician relationship.
Yeah, and what are some common barriers that patients face in, making that a very healthy relationship?
We always want patients to feel comfortable. Patients oftentimes have fear, or they may feel intimidated. They may hesitate to ask questions. Medicine is complicated. We know it's a complex scientific field, but we also have an entire vocabulary in medicine and in how we talk about disease, and that alone can be intimidating for patients.
I feel like a little off the script here, just the fear of asking questions has always been so instilled in us.
Yes.
Where the second you start asking them, you start understanding.
Yes, absolutely. And I think now patients come with a lot more information in hand. The internet has sort of democratized a lot of that information. And so I think we feel like patients have a lot more information and so come a lot more equipped than they may have before.
That's a good point with the internet and stuff like that. Do you find that they've been informed in a kind of weird direction to where they might have some kind of misconstrued idea?
For sure. As with all things, as we kind of know in the modern day, not everything on the internet is as accurate as we'd all hope it to be. And so depending on where patients get their information, sometimes they may have preconceived notions about what they think about certain things. But in some ways, that's no different than what happened kind of in small communities before, where people's perceptions were driven by what other people told them. This is just on a larger scale. And so sometimes we do have to educate in and around that and direct patients towards reputable sources.
Well, it's cool that that's a big factor, directing towards the reputable sources. And, getting back on here, how would you personally actually approach visiting a new patient?
The first thing I do is I oftentimes tell patients, because of what I do specifically within our cardiovascular program, I try to remind them that I understand that what we're going to talk about is something that I do every single day, but for them will probably be a once-in-a-lifetime occurrence. That's sort of the touch point. Then we kind of go from there, where I often listen to their story, try to understand what their symptoms are, what drove them to present to me, or how they ended up talking to me. And then try to figure out where they want to get to at the end of their treatment and what their goals and objectives are. We obviously then spend a lot of time, especially with what I do personally, diving into diagnostic testing, imaging, prior records. Oftentimes, these patients will have seen other cardiologists, and I'm looking at those notes. For me personally, we do some complex procedures where we're communicating a lot with our cardiac surgeons and other folks, and we will have a conference about a lot of our patients, either before or after that visit. And oftentimes we'll bring information from that conference back to them and say, hey, this is what not only do I think, but this is what the team of us thinks.
Wow. So is there a lot that a patient should be thinking about before the appointment, things to bring in, like you were mentioning, maybe other reports?
Getting back to the basics, I think having a really complete list of your medications is first and foremost. And I honestly tell a lot of our patients, just bring them in. Take everything that you take on a daily basis and just put it in a bag and bring it in. Honestly, that's easier for us. These names are hard. The doses are hard. How frequently you're taking them can be complicated. Writing down some notes about why you're seeing someone, I think it's oftentimes hard to remember all those details in the moment. And then electronic health records have made this better. So we can get access to a lot of records for testing and imaging done elsewhere, but I always encourage people to do it because, believe it or not, in 2026, we still rely sometimes on phone calls and fax machines to get records around, unbelievable as that may seem. So anything that patients can bring with them is always good. And I think just being open and honest to the discussion and sort of trying to know that, hey, we're just trying to present you with some information, so just be ready to listen. And then we always, especially for the patients that I see, we often tell them, bring a family member or bring a friend. It's hard to listen to all that information yourself, so you have someone else there with you that can listen as well. They may hear something differently or may hear something that you may have missed.
Definitely. Yeah. I mean, having somebody alongside with you, I know a bunch of people who are more knowledgeable on that kind of stuff than I am. So if I was in that position, I would totally bring them along.
Yeah.
To help it make sense for me too.
Yeah. And I think, like I said, what I specifically do, we're talking about valve replacements for patients. A lot of our patients are elderly, so we always encourage them to bring spouses, children, anybody else who's going to be around. And oftentimes those people end up helping us take care of these folks for a few days, few weeks after they've had their procedure. And so if they're part of that conversation up front, it's helpful.
And so your position being the Chief of Cardiology there at Vitruvian Healthcare, what steps have you taken to just make this a better system overall for the patient-provider relationship?
The first and most important thing we've done is recruit. I think you have to want to grow the program, and we've recruited quite a few physicians here. We're now at 11 cardiologists in Dalton with 2 vascular surgeons, 2 cardiac surgeons, but we've recruited intentionally for skill set and for personality and fit, both at the team level, but also in a patient-facing level. Everyone that we've recruited, we've thought to ourselves, hey, does this person add value both clinically and interpersonally to our program? So I think that's first and foremost. Obviously, the other things that we do, we try to build schedules and build our operations and build the actual mechanics of how we deliver care in a way that encourages that continuity, encourages that physician-patient relationship, and gives patients and providers time, consistency, and opportunity to build that relationship.
Finally here, is there anything else that you think patients should just know beforehand?
I think just know that we're here. I think especially in more rural communities, I think ability to have the specialists that we have here is very unique and special. And so I think a lot of things that, may have otherwise just been pushed aside as symptoms that folks need to deal with, or, hey, we don't have someone around who can do those advanced things that historically you may have had to go to Atlanta or Nashville for. Just ask the question of your family, your primary care provider, hey, is it worth it for me to go see these folks, or avail yourselves of that on your own and come see us, and we're happy to help answer those questions if you may have any.
Yeah, well, thank you very much, Dr. Patel, for just joining us here. This was a nice and a simple episode to get people more knowledgeable on exactly what you do.
Thank you for having me.
Hamilton Physicians Group Cardiology has offices in Dalton, Calhoun, Ringgold, and Cleveland. To make an appointment, call 706-226-3434. 706-226-3434 or visit vitruvianhealth.com/cardiology to learn more.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.